Okay, the first item on our agenda is the accreditation of the Bahrain facility of the Royal College of Surgeons in Ireland. A report on the accreditation of the Bahrain facility of the Royal College of Surgeons in Ireland was prepared by Ceartas, which is the Irish Lawyers for Human Rights, in May of this year. And Ceartas, I hope I'm pronouncing that right, Ceartas wrote to the committee requesting that they have an opportunity to raise the issue with us, and accordingly we have a presentation on that issue today. And following that we have discussions about the junior cycle. So from Ceartas I would like to welcome Garrod O'Quinn and Jerry Liston of Ceartas to the meeting, and I invite Mr O'Quinn to make his presentation.
Thank you very much, and thank you for the opportunity to present. Today I will be speaking on the issue of RCSI-Bahrain, and Ceartas is an organisation committed to taking legal action on international human rights issues from Ireland. As RCSI-Bahrain awards Irish medical degrees, as a result of Section 88 of the Medical Practitioners Act, there is an obligation on the Irish Medical Council to monitor and accredit RCSI-Bahrain and its programmes of education. For the purposes of accreditation, the Medical Council has adopted the World Federation for Medical Education Standards, also known as the WFME standards, which I'll refer to throughout this presentation. These standards provide a mechanism for quality improvement in medical education, and they recognise the practical dimensions of medicine and the requirements for hands-on experience in clinical tuition. Thus, they demand that the locations of clinical tuition must be, number 1, safe, 2, appropriate, 3, able to deliver training in the core competencies of medicine, and this includes, and I stress this, medical ethics. They're also the same standards that are applied to medical education programmes in Ireland. Many of the human rights abuses documented in Bahrain over the last 2 years have involved medical personnel and facilities, public and private, utilised by RCSI Bahrain. As the committee may already know, Dr. Al-Ekri, an RCSI fellow, is one of the medics who continues to serve a prison sentence for what the Physicians for Human Rights termed treating protesters and giving interviews. Thus, from the perspective of Ceartas, there was an overlap between the human rights violations in hospitals and the WFME standards used by the IMC, or the Irish Medical Council. And I would like to sum up 3 major areas of concern that we have identified, and a lot of this is already detailed in our report, which has been sent around. The first is access and provision of healthcare. During the Arab Spring protests in 2011, numerous medical personnel were tortured and imprisoned. And today, injured protesters and those affected by indiscriminate use of force by the Bahraini authorities fear using hospitals and clinics that are used by RCSI in the training of their students. And we have documented consistent allegations of abuse in this regard. We have included accounts from reputable sources of patients being picked up from RCSI-utilised hospitals and who have subsequently been tortured. Secondly, restrictions on freedom of expression in matters relating to healthcare. Medical personnel consistently report on their fear of speaking out. I would direct the committee to the annexes of our report showing communiques instructing doctors to pass information on suspected activists to security forces. In some cases, patients are vetted before they are treated. Doctors who complain of human rights abuses are targeted, and I'm happy to supplement accounts in our report with more ongoing examples which have occurred recently. In sum, the continuing detention of Dr. Al-Ekri and the targeting of doctors, violations of medical neutrality have all had a chilling effect on the entire medical system that interfaces with the ongoing political system. The heads of hospitals, I'd like to turn to discrimination. The heads of hospitals and clinics have been replaced with doctors of the Sunni sect. We have also documented how 30 RCSI students were denied work placements simply for being Shia. The examples are too numerous to mention here, and they have been documented at length in our report. For more information on discrimination and access to appropriate healthcare, I'd also direct the committee to the report of the Bahrain Centre for Human Rights on the politicisation of sickle cell disease, which makes for grim reading. Sickle cell disease affects mostly the Shia population. As I mentioned already, the WFME standards adopted by the Irish Medical Council require that the facilities used in clinical tuition should be safe, appropriate and able to deliver on the core competencies, including medical ethics. We submit that the facilities used by RCSI Bahrain are not an environment that lives up to Irish standards, and that these allegations are of such a consistent and serious nature that they overshadow any claims of medical excellence. We'd also like to highlight the fact that RCSI Bahrain is not immune from the political order that is prevalent in Bahrain at this moment. You may already know that the conference on medical ethics that they tried to organise in association with Médecins Sans Frontières was blocked. And this resulted in the resignation of Professor Tom Collins, the head of RCSI-Bahrain, who also confirmed the militarisation of the healthcare system and the hapless position of RCSI-Bahrain in its ability to influence the situation there. RCSI-Bahrain's strategic plan for the next few years completely fails to mention the unrest that has swept Bahrain and how it has disrupted the healthcare system. But they have mentioned things like the economic downturn. RCSI's open days are now sponsored by the Bahrain Defence Forces. In terms of moving forward, what is of particular importance, what we think is of particular importance to the committee, is that until RCSI's education programme is evaluated by the Medical Council, the use of Bahraini hospitals is deemed to be approved by Section 88 of the Medical Practitioners Act. We would argue that this undermines the integrity of Irish standards and also of Irish medical degrees. The Medical Council, taking a stance in line with international standards, should not be done in an a la carte fashion. The Medical Council should proactively embrace these standards and apply them as they would in Ireland. And this is explicitly required under the Medical Practitioners Act 2007. In terms of recommendations for action, we respectfully suggest that the committee recommends to the Minister for Education and Skills that RCSI Bahrain falls short of Irish accreditation standards. And this situation prompts appropriate action in accordance with the Medical Practitioner Act of 2007. And likewise, the committee should bring it to the Minister's attention the adequacy of other streams of Irish accreditation, including the National University of Ireland and Quality Qualifications Ireland. We urge the committee to invite the Medical Council to explain how they intend to approach the accreditation of RCSI Bahrain and the human rights concerns affecting the sites of clinical tuition used by RCSI Bahrain. Thank you very much for your time.
Okay, thanks very much. We'll now take questions on the matter, starting with Senator Power.
Yeah, I just want to start, sorry, I have a sore throat. I want to start by saying that I think this is a very serious issue, and I think it's something that the committee should be concerned about, because it not just affects the reputation of the RCSI in Bahrain and indeed at home, but it also affects the reputation of Irish education as a whole, which is something that we're trying to export now to other countries, and whose reputation shouldn't be in doubt. Gerard has made the main points. I was in Bahrain, as some members might know, on a delegation, Irish delegation 2 years ago, with doctors, human rights activists and others, and heard the testimonies that you've spoken about, where students were telling us that in previous years all members of the graduating class would automatically get a placement in the state hospital so they could do the professional aspect, and that now after the protests that took place after the Arab Spring in Bahrain, that the distinction was now being made on sectarian grounds between some students and others. I think that is the type of thing that should be of extreme concern to us, that any Irish institution would be involved in that type of thing. As well, for Tom Collins to have resigned. Tom Collins is an incredibly well-respected academic in Ireland, from his work on the NCCA, the Curriculum Advisory Council and others, and for him to have resigned from that position, having gone to Bahrain and said that he wasn't satisfied to keep doing it given the human rights context, again, I think is something that we should take very seriously. So I strongly feel that it is appropriate for the committee to express its concerns on this issue and ask that they be looked at. I think it's alarming. Things are just getting worse day by day in Bahrain. And there's whole wider issues around medical neutrality, all of those things. Amnesty International, all the various groups, the European Commissioner for Human Rights, have expressed concerns about medics, that Irish trained medics, these are Ali Al-Rekri and others, are people who trained in Dublin as part of their RCSI training, and then were arrested in Bahrain simply for treating injured protesters. And then for expressing concern and anger on TV about the fact that people had been shot in the back of the head and things like that, and then for that reason they were rounded up and arrested and are still in prison. So I thank Gerard for coming in to make this presentation today, and I would urge members that it is appropriate for this committee to express concern on an Irish institution having such a dark cloud in relation to its human rights, and particularly the safety of its students. Every institution has a responsibility to protect the safety of all of its students, regardless of their ethnicity or their religion or anything else.
Okay, Senator O'Claherty.
I think it's a very important presentation. I'm concerned as well about the length of time it is to get action on the issue, and I'd echo exactly what's been said by Senator Power, and to say that we would support also the call. I think just because something's happening a long way away from Ireland doesn't mean that we should be washing our hands of the issue. Far from it. I think that the basic civil rights here of the doctors in question have to be supported, and we have to do everything we can to do that. And I'd certainly support the call that do that in the ways that have been suggested.
Anyone else? Okay. All right. Gerard, do you want to respond to those?
No, we welcome the support, and we agree that there are certain things that should be of concern. And apart from what I've already presented, what we're also very concerned on is the lack of transparency. Organisations such as Médecins Sans Frontières, Physicians for Human Rights, and critically, the UN Special Rapporteur on Torture can't get into Bahrain. So how do we know what is happening within the facilities, and whose word do we take on this? One of the problems we've discovered as well is that documenting the abuses is getting more difficult. We just participated in a campaign called End to Impunity. It finished there 2 days ago, and some of the members who we worked with have subsequently been arrested. Others have gone into exile, including Youssef Saif, who is the head of documentation for the Bahrain Centre for Human Rights. So we think that the violations will soon become invisible, but that does not mean they're not ongoing. So there needs to be an effort, I suppose, by the Medical Council to programmatise what is happening, or systematically find out what is happening. And lastly, I'd just like to point out that in relation to what we've seen from RCSI senior staff who have commented in the Irish media, I think I've handed you some news items, and this includes news item 2, which refers to extremely anecdotal evidence of their awareness of what is going on in the facilities, quoting some of their students, quoting from what they've heard from seniors, from their medical students. We've heard nothing. What we've documented is that people are afraid of speaking out, especially students who have invested so heavily in their medical career, and that something programmatic needs to be done to ensure that Irish standards are really being lived up to in this, what is essentially a hostile environment.
Did your colleague Jerry want to add anything to that?
Well, I think one thing just important to stress is the legislative context here. At the moment, as it stands, the situation in Bahrain is actually being approved by operation of Irish law, because, as Gerard stressed, until the Medical Council go out and conduct a process of accreditation in Bahrain, the Section 88.6 of the Medical Practitioners Act 2007 actually deems the situation to be approved. So that adds to the urgency. I mean, Irish law is actually approving the situation in Bahrain right now, and I think that heightens the urgency that the Medical Council need to go out and conduct their process of accreditation.
Okay. Senator O'Donnell, did you have a question?
No, I just read you. I think it's the most damning what you say. It's the most worrying what you say. Where is RCSI in reaction to all of this?
Well, we can only go from what they've said publicly, and as I've said, it does appear, we've pointed out that the strategic plan doesn't even mention the impact on the health sector that the unrest has had, and it's not clear. We've also learned from Médecins Sans Frontières that there's been attempts to, for example, screen a film from Médecins Sans Frontières dealing with access to the danger zone, it was called. It's narrated by Daniel Day-Lewis. This was pulled in mysterious circumstances after an email had been sent out to staff and students. So after Tom Collins resigned, the silence on the issue that they can't even have a conversation on medical ethics. What does it say about the position of doctors who are in hospitals and people who have been trained on what medical ethics is? These students graduate with NUI degrees. Is this appropriate that they are graduating with this? I suppose, a level of fear and distrust where they can't even bring up the medical ethics in a conversation. So it's not clear. And after Tom Collins resigned, a delegation did go out, but it looks like it was to apologise. And there was nothing brought out in favour of Tom Collins' position or on the issue of medical ethics as an area of acute concern for Bahrain.
Right. Well, I suppose, is there anyone else? No? Okay, well, Gerard and Jerry, is there, as a committee, what would you like us to do as a follow-up?
Yes, just to kind of emphasise as what I've followed on from the end of my report presentation, I'd like the committee to recommend to the Minister for Education and Skills that RCSI currently falls short of Irish accreditation standards and that action is required in accordance with the Medical Practitioners Act. In other words, the formulae that needs to be applied is the standards that are set in Ireland need to be applied in Bahrain. Because if you're handing out Irish degrees, they need to live up to those standards. And the Bahrainis have consented to those standards being there. So it's not about RCSI telling Bahrain what to do. Bahrainis have already consented to these standards. And second of all, that perhaps that the Medical Council could be invited in front of the committee to explain how they will approach the key issues of human rights violations within these facilities. Will they be factored into their analysis, as it should be in accordance with the WFME standards, which have been adopted by the Medical Council for Irish degrees? And I'll just give you one standard 8.5, for example, on basic medical education. And this is on page 11 of our report. It says the medical school must have a constructive interaction with the health and health-related sectors of society and government. It also talks about appropriate supervision, safe environment. We've listed on page 14 all of the WFME standards that require free and open communication for feedback, complaints, reviews. With the restricted environment where people can't speak out, how can this process I hope to live up to Irish standards? So these kind of key questions of how the facilities live up will be appreciated.
Okay, Senator O'Claherty.
Yeah, just for my own clarification on this, I mean, to cut to the chase, is this a question of money? Basically, is there a contract between the RCSI and the Bahraini authorities that is worth a lot to the college, and that really they're turning a blind eye to the human rights of the doctors that we're talking about here because of the financial implications? Is there any? Do we have any information around what the contract, for example, for the education and the training is worth to the college?
It's a very good question. I don't want to comment on the specifics about our money, but clearly there is a tension there between issues of medical ethics, neutrality, and the investments at RCSI. And it beggars the question: what is a non-profit organisation like RCSI doing in an oil-rich, monarchical, sectarian state? It's not clear. It's not as if they're lacking in health infrastructure. So also it will be interesting, as RCSI is subject to the Freedom of Information Act, how they conduct themselves if such requests were made. Will they cite economic sensitivity? Or will they, in the spirit of transparency, openly give such information on contracts with the Bahrainis?
Okay. Well, I suppose just arising out of that, I think as a committee, would we write to the Minister along the lines that suggested there that basically the wording there that Garo just gave, and I suppose looking for his response. Okay, so that's one thing we could do. And secondly, I mean, we could write possibly to the Medical Council as well with a similar letter. Any other suggestions on that?
Are you also requesting, Mr. Quinn, that there's a visit by the Medical Council there? Was that one of your...
Yeah, well, it's for the committee to visit. But also, I think, under Irish law, the council are obliged to conduct a site visit.
Yes.
So, and I think it's important because if a special rapporteur on torture can get in, maybe the medical council getting in could be a public request.
Yeah. All right. Okay. Are members agreed with that? Yeah.
I suppose I'd like to propose a two-pronged approach. One, I think it is a good suggestion to invite in the Medical Council or others to discuss it, but I know given our agenda that's likely to be some time.
Yeah.
So I think in the interim, I'd propose that we would write to the Minister for Education, as suggested by the group, and express concern to say that the committee is concerned that the college may not be in accordance with its accreditation and would ask for an urgent investigation. So that at least we're asking for an investigation now, while if we're waiting for groups to come into us, at least we're calling for that to be done straight away, because this is going on for 2 years, just over 2.5 years at this stage, I think.
Would there be any suggestion we should write to the college as well, or
yeah. And the NUI as well, or just the Minister?
Yeah, the NUI, judging from Bahraini documents, they are expecting some sort of mysterious accreditation process by NUI, but it's not clear what standards they use. It's not clear if it lives up to, will it address the issues that are happening on the ground, or will they just focus narrowly on the school and the classroom? Because they're not, the two things are interlinked. And you also have Quality Qualifications Ireland, which accredits on quality assurance but doesn't visit.
Okay, sorry.
Sorry.
So I didn't think it was going on, and that we would. I also feel that perhaps you should have given witness at a health committee as well, because this is a health issue as well as being an education issue. Last year I met with a lovely doctor, her name escapes me, from Bahrain. She was here, but she couldn't go back home simply because she had given medical attention to a protester. And she was in fear of her life. Her children were in Bahrain. She couldn't go back to see her children, but she was here for quite some time before she could, return home safely. But it would be no harm, perhaps, if witness was given at a health committee as well on the health issues, that's happening over there. And I would second the proposal to write to the Minister on this.
Okay, so we'll write to the Minister, we'll write to the Medical Council, and then possibly we'll invite the Medical Council in the new year, and then, I mean, you were suggesting NUI, was it?
Well, NUI,
Would that not come under the Department Minister for Education?
well, I suppose, yeah, it's a good question. Everything does tend to come under the medical practitioner, but it is an education issue, I suppose, in that regard. And it would be interesting if it's talking to RCSI, how do they evaluate the facilities? What mechanisms have they in place?
Yeah, well, we could try to the RSI.
It's very important because they're at the centre of this.
Yeah, well, I think so, yeah. And I think as well, just, I suppose, out of courtesy as well. Okay, is that agreed? Okay, agreed. Okay, so thanks very much. Thank you. Right, so we're now moving to our next item.